Stomach cancer, also known as gastric cancer, is a condition where cells in the stomach grow out of control and form a tumor. Your stomach is like a muscular sac located in the upper abdomen, just below the ribs. It plays a key role in digestion by mixing food with stomach acid and enzymes to break it down before it moves to the small intestine. Stomach cancer occurs when normal, healthy cells in your stomach begin to grow uncontrollably and form a mass called a tumor. Most stomach cancers start in the lining of the stomach in a layer called the mucosa. One of the reasons stomach cancer is so dangerous is that its early stages are often with no symptoms or present with very subtle signs that can easily be mistaken for less serious conditions like indigestion or heartburn. Over time, the cancer can grow deeper into the stomach wall and spread to nearby organs like the liver, pancreas, or intestines. It can also spread to distant parts of the body through the bloodstream or lymphatic system. Stomach cancer ranks as the fifth most common cancer and the third leading cause of cancer-related deaths worldwide. Nearly 1 million new cases are reported annually, especially concentrated in East Asia due to factors like diet and Helicobacter pylori infections. Types of stomach cancer. There are several different types of stomach cancer. Each behaves slightly differently. Number 1. Adenocarcinoma. This is the most common type, making up about 90 to 95% of all stomach cancers. It starts in the glandular cells which form the innermost lining of your stomach. These cells produce mucus and digestive juices. Adenocarcinoma can be further divided into two subtypes, intestinal and diffuse. The intestinal type tends to grow more slowly and is often linked to factors like chronic inflammation, while the diffuse type is more aggressive and can spread quickly. Number 2. Gastrointestinal stromal tumor. This is a rare type of stomach cancer that starts in special cells in the stomach wall called interstitial cells of Kegel. These cells help control the movement of food through the digestive tract. Gastrointestinal stromal tumors can be benign, meaning non-cancerous, or malignant, meaning cancerous, and they require specialized treatment. Number 3. Lymphoma. This type of cancer starts in the immune system cells in the stomach wall. It's rare and usually occurs in people with a weakened immune system or a history of certain infections, like Helicobacter pylori. Symptoms of stomach cancer. In the early stages, there may be no noticeable symptoms, or they may be mild enough to be mistaken for common digestive issues. One of the first signs you will have is often persistent indigestion or heartburn that does not improve with medication. Your appetite might start to change subtly. Foods you once enjoyed might suddenly seem unappealing. You'll notice you're feeling full much faster than usual, even after eating small amounts. It's as if your stomach is sending signals that something is interfering with its normal functioning. As the cancer grows, symptoms become more pronounced and harder to ignore. Unexplained weight loss becomes significant. We're not talking about a few pounds, but a noticeable and rapid decline in your body weight without any intentional dieting or exercise changes. Abdominal pain transforms from a mild discomfort to a more persistent ache. This pain isn't sharp or stabbing, but a deep, gnawing sensation that seems to originate from the core of your stomach. It might feel like a constant pressure or a dull throb that doesn't seem to have a clear trigger. One of the most concerning symptoms involves changes in your digestive system's normal processes. You might start noticing blood in your stool. It could appear black and tarry, which indicates internal bleeding. Vomiting might also include blood, appearing either bright red or dark and resembling coffee grounds. In later stages, symptoms become more dramatic. Significant swelling in your abdomen might occur. Some patients experience a feeling of a mass or lump in their stomach area. Since many of these symptoms overlap with other gastrointestinal conditions, such as ulcers or gastritis, it is important to seek medical evaluation if symptoms persist or worsen over time. Causes of stomach cancer. The exact cause of stomach cancer is not always clear, but several risk factors have been identified that increase the likelihood of developing the disease. Infection with Helicobacter pylori bacteria is one of the most significant risk factors, as this bacterium can cause chronic inflammation and ulcers in the stomach lining, which may lead to cancer over time. Long-term gastritis and inflammation of the stomach is another known cause, particularly when it results in damage to the stomach cells. Certain dietary habits also play a role in stomach cancer development. A diet high in smoked, salted, or pickled foods has been linked to a higher risk, while a diet rich in fresh fruits, vegetables, and fiber is believed to provide protection. Smoking significantly increases the risk of stomach cancer, especially in the upper portion of the stomach near the esophagus. Excessive alcohol consumption may also contribute to the disease by irritating the stomach lining and promoting cellular changes. Genetics can also influence stomach cancer risk. Individuals with a family history of the disease or specific inherited conditions, such as Lynch syndrome or hereditary diffuse gastric cancer, may have a higher likelihood of developing stomach cancer. Other contributing factors include obesity, previous stomach surgeries, and exposure to certain chemicals or industrial dust. Diagnosis of stomach cancer. If your doctor suspects stomach cancer, they'll typically use several methods to confirm the diagnosis. Physical examination comes first. Your doctor will feel your abdomen for any unusual masses and check for swollen lymph nodes. Endoscopy is usually the next step. Here, a thin, flexible tube with a camera is passed down your throat into your stomach. This lets doctors see inside your stomach and take small tissue samples, or biopsies, if needed. Imaging tests help determine if cancer has spread. These might include CT scans, PET scans, or MRI scans. Each gives different information about the cancer's location and extent. Blood tests can also check for signs of anemia or other changes that might indicate cancer. They can also measure markers that some stomach cancers produce. Stages of stomach cancer. Staging is a critical process that helps doctors understand how far stomach cancer has spread and determine the most appropriate treatment. Stage 0, or carcinoma in situ. Cancer is extremely early, found only in the innermost layer of the stomach lining. It hasn't spread beyond this layer and is typically the most treatable stage. Stage 1. The cancer has grown through the first few layers of the stomach but hasn't spread to lymph nodes or distant parts of the body. Stage 2. Cancer has grown deeper into the stomach wall and might have spread to nearby lymph nodes, but hasn't reached distant organs. Stage 3. The cancer has significantly penetrated the stomach wall and spread to multiple nearby lymph nodes. It may have invaded adjacent tissues, but hasn't reached distant organs. Stage 4. This is the most advanced stage. The cancer has spread beyond the stomach to distant organs like the liver, lungs, or other parts of the abdomen. This stage indicates widespread metastasis. Treatment for stomach cancer. The treatment for stomach cancer depends on the type and stage of the cancer, as well as your overall health. Here are the different treatment options. Number 1. Surgery. Surgery is often the primary treatment for stomach cancer. The type of surgery depends on where the cancer is located and how far it has spread. For early-stage cancers, doctors might remove only part of your stomach, also known as partial gastrectomy. For more advanced cases, they might need to remove your entire stomach, known as total gastrectomy. After a total gastrectomy, your esophagus is connected directly to your small intestine, and you can still eat and drink, though you'll need to adjust to smaller portions. Number 2. Chemotherapy. Chemotherapy uses drugs to kill cancer cells throughout your body. You might receive chemotherapy before surgery to shrink the tumor, making it easier to remove. Or you might get it after surgery to kill any remaining cancer cells. Sometimes, chemotherapy is the main treatment if surgery isn't possible. The drugs are usually given through an IV line, and treatment typically occurs in cycles with rest periods in between. Number 3. Radiation therapy. Radiation therapy uses high-energy beams to destroy cancer cells. It's often combined with chemotherapy either before or after surgery. External beam radiation therapy is the most common type, where radiation is directed at the cancer from a machine outside your body. Treatment usually occurs 5 days a week for several weeks. Number 4. Targeted therapy. These newer drugs target specific features of cancer cells. For instance, trastuzumab targets cancer cells that have too much of a protein called HER2. Not all stomach cancers have this feature, so doctors test for it first. Other targeted therapies work by blocking blood vessel growth to tumors or helping your immune system fight the cancer. Number 5. Immunotherapy. This treatment helps your immune system recognize and attack cancer cells. Drugs called checkpoint inhibitors can be effective for some people with advanced stomach cancer. They work by removing the brakes that stop immune cells from attacking cancer cells. At the end, always remember early detection often leads to better outcomes, so don't ignore persistent stomach symptoms. While they're more likely to be caused by less serious conditions, it's worth getting checked out if they don't go away. Now, we want to hear from you. Have you or someone you know been affected by stomach cancer? What was the experience like, and what treatments or lifestyle changes helped the most? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.